Uh, Hello, everybody. Good afternoon. So go over the data over the weekend. So moving forward on weekends, some of the hospital data will probably just report it all out accurately on Monday. Scattered reporting, and so we'd rather give accurate information than what we think is right related to weekend reporting on hospitalizations. Unfortunately, over the last, we'll say, 72 hours, we've lost two members of the community, Caucasian male in his 90s, and one resident of a nursing home. So certainly our thoughts and prayers are with these families, these individuals, and everybody. We're on the eve of our first case tomorrow, so we've been doing this for a while, and certainly planning and preparing for this virus in weeks ahead of this. So it's been a long year, certainly. Positive rate is in good shape, 7-day average at 0.7%. I actually look back. We've been in this spot for over a month now, between 0.7 and 1. We only, in the summertime, I think for a day or two, our 7-day average was below 0.7. So really, really good that our community is where it is. Our caseloads have dropped. They were between 50 and 100, closer to 50 if you looked at everything. Now it's kind of in that 40 to 80 case range per day. Today we have 61 new cases, and we have 395 active cases. Hospital numbers down to 43, but we do have 13 of our neighbors in the ICU, so please keep them in your thoughts and prayers. Related to the vaccine, we continue to vaccinate at pretty high levels. I think our number going into today was, essentially around 37% of the adult population and about 29% of our overall population. Remember, the difference between this is that kids can't be vaccinated right now regardless. The vaccine hasn't been deemed ready for children. Children make up about 100,000 of our residents in the community. So we're doing really well with the vaccine. I've encouraged the state to open up vaccine eligibility. I asked the state to consider 50 and above, and also specifically agricultural workers and food security workers, if they're going to go in that category. It doesn't make sense. So if you think about it, there's a little bit of the upstate downstate divide here. The taxi drivers, for example, very big issue in downstate, makes sense, vaccinations. But when you talk about our ag economy in upstate and food security for the whole state, really our ag workers need to get vaccinated. And so pretty critical that we all eat. Again, I've asked the state to either expand that or to give the counties the ability to do it. Homebound seniors, right now, for the most part, most of our seniors have been vaccinated. Right now, the challenge is getting to the folks who can't leave their homes. Last week, we talked about an Essential Health. One of the home care companies that wants to vaccinate, we reallocated vaccine to them to vaccinate their clients. Now we need to find homebound seniors and get them, once we know where they are, start to implement a plan to get to them. So we released yesterday our phone number, 315-679-4099. We have a phone bank operating from noon to 4. Based off of call volume, we'll staff up to the demand. It's tough to know how many folks are out there, and so that's what our goal is. Also, you can email us at covidvaccinations@ongov.net. This gives us the ability to take down information. Certainly, we want to build up this database for the next week or so here, and then hopefully have a good idea on how many seniors are out there so we can start to get the vaccine out there. Part of the challenge is now the J&J vaccine would be the easiest vaccine to use here. I think we only received a couple hundred doses for our next week, being Wednesday to Wednesday. So certainly if the expectation is that we have many more than a couple hundred seniors who need to get vaccinated, we may be in a situation where we have to use Pfizer or Moderna and then just go back for second shots. So but this is, it's nice to be at this point with this group where we're micro-targeting. I think when it's shows you where we are, how we continue to play offense, which is good. More vaccine appointments will open up throughout the week. Again, getting an appointment should get easier and easier. We, I think, have clinics today and tomorrow, and on Wednesday we'll be opening up more appointments as well, or maybe even before Wednesday once we know we physically have the vaccine. But again, we're going to receive another 6,000 or so doses of vaccine, for next Wednesday to Wednesday, and certainly we may even get more based off of where things are trending. So certainly there's ample supply right now for the eligibility. That's why we're pushing on eligibility to increase. Reminder about symptomatic testing, ongov.net/Cayuga Medical, Monday through Friday, 9 to 1. Please, if you have symptoms, any symptoms, please get a test. This is the way we identify and isolate and box in this virus. Asymptomatic testing at our community sites or here at the On Center, covid19.ongov.net. Today we're in East Syracuse at the Village. Tomorrow we're at the Northeast Community Center in Shove Park. Wednesday we'll be at the Fayetteville Village Hall, Skinny Atlas School District. Thursday, Onondaga Town Hall. Friday, Lafayette Community Center and the Town of Clay Senior Center. These are all community sites. We're also testing in schools this week as well. So we continue to build up the data, tracking everything in schools so that we see if there's any trends or any shifts with transmission in schools. But again, to date, there's been no data to show that the virus is spreading in schools. The positivity rates of kids who are remote and in-person learning is the exact same, essentially. So, we're happy that it looks like we'll be getting some partitions in this week to get out to some districts. We've ordered lots of partitions, and it looks like a lot of districts will be modifying their plans the last week of March, first week of April, when the break comes back. So we're very pleased to be able to help get these kids back into school more often for in-person learning. Thursday, I'll have details on the landlord rental assistance program for their tenants. Essentially, we've done a survey. We've looked at it. We have an idea on how big the problem is, and certainly we'll make some final touches on that. But we expect that to probably applications for that to become eligible probably again last week of March, first week in April. We'll start getting money out the door to folks. Saying that, happy to take questions.
There's been a lot of reporting that county executives were called over the weekend by Larry Schwartz, an aide to the governor. Did you receive one of those phone calls?
I did not talk to Larry this weekend.
In that theme, were there any calls to this weekend that alarmed you in a way that loyalty to the governor might be rewarded with vaccine supply?
So I've never had that conversation with Larry. I saw the reports. I've talked to my colleagues. I do know calls were made. Different folks took the calls different ways. I do know that this is a fear of everyone, including I think this governor at one point with the previous administration, was politics in the vaccination process. And a fear of counties is that politics is being played or can be potentially be played. So the phone calls, whether intentional or not, left a chilling effect for not just county executives, but county leaders throughout the state. And I think this goes to some of our frustration levels about where we are in the pandemic and getting things back to local control. Some of these situations are avoidable if every little change based off of the data in our community county executives or leaders who have been elected by people to deal with these emergency situations don't have to go to the state and say, what do you think about this little tweak or that? It's getting to the point where it's overbearing. And we were the ones elected. The way that the new legislation is, I don't even know how it's supposed to work now. The governor has to go before a committee of people that weren't elected in Onondaga County to make decisions for us. We're at a point with the pandemic where things need to be turned back to local governments who were elected to do this exact same thing, to lead in emergencies. So there certainly are things that you need to still do at a statewide level, but when we have to go consistently for basic things, that the decision should be made based off of the conditions on the ground in your community, it doesn't work well. And to avoid these types of incidences where it can be if I'm scared to have an opinion on this issue because it might make this person mad or that person mad, the less we have to do basic things and we can just make decisions on our own, it avoids all that. So I think it highlights the problem, Andrew, right now, that we are at a different stage in the pandemic. Many of the emergency powers that impact local government's day-to-day operations aren't necessary anymore. The vaccine's a little different. They're not going to change the vaccine rollout overnight, but empowering local governments and county health departments who vaccinated for decades to have more control in our own communities, which I think has been the trend, is where this should be going. The state has done a nice job setting up state mass vaccination sites. They've done that. They've done a nice job working with us to do pop-up clinics and give us a little bit extra supply for that. Now they should be basically sending us as much supply as they can and telling us to go finish up vaccinating our community, specifically in hard-to-reach areas. This can't be political. Conversations can't be mingled the way that it looks like these may have been, no matter what the intentions were.
I do want to be clear. Did you receive any calls this weekend from anyone
No.
at the state level?
No, nobody called me about what's my position on the governor's current situations and then started talking about vaccines the next second later. Nobody had those conversations with me.
Is your position the same, that the investigation should happen before any calls to resign?
I believe in due process, and I think that's important. But I'm also saying we're at a point now where we need to have local control back. Every time I have a question from me about something in our community that under normal circumstances in an emergency we would be dealing with, we need to be able to deal with. The focus right now in Albany isn't on getting some of these small related items that are small in their eyes but very important in our community's eyes. Look at, I've talked to the state today and I ask about restaurants. Is it feasible why we're at 0.7% positive rate for a month and restaurants are closed at 11 o'clock still when SU's playing at 9:40? Are we going to kick everybody out of the place at halftime, or are we setting ourselves up for failure, right? I understand if a community's positive rate is much, much higher, that's a potential pressure point. But that's not where we are. We've managed this crisis. We've seen the conditions on the ground before the state has. Let us manage our own community now. We're in a different spot of the pandemic. So I think overall, a way to avoid some of this anxiety between local governments and state governments is to basically give us our power back. We were the ones elected in our communities.
An Onondaga County resident emailed us over the weekend. His name is Earl. He asked us a question about two area pharmacies that he talked to about the vaccine, and he claims told him that they would throw away expiring doses of vaccine rather than give it to people who are not eligible. Are you aware of any issues with pharmacies there? And you did say we have more of an ample supply right now, so
yeah. So I think one of the rules is that if you give, I believe it's still a rule. Now I will break this rule If we will not waste a dose. I would rather give anybody a shot than waste a dose. And if the state wants to try to fine me for that, good luck. But I think that's part of the challenge here, right? So I don't know who Earl is. I don't know who Earl's talking about. But no pharmacy should be wasting any vaccines. If they are worried about that, they should call us, and we'll find a way to get it into somebody's arm.
You brought up the restaurants closing at 11 o'clock. What did the state say about that? Are they going to take everyone out of the top time?
Look, I'm going to give them time. I talked to them about it. I know they're increasing capacity, I think, later this week. These are things that they shouldn't be in the business with anymore. So at the end of the day, if they increase it, I'm happy. But again, why am I focused in? Why do I have to go to a state government for a rule like this at this point in the game? And why isn't it just our authority the way it normally would be? When we're making laws, we have certain emergency powers, but if we're making, you have to go through a deliberative process with the legislative branch of government where there's checks and balances. At this point of the pandemic, we don't need to be micromanaged. We've been through this. We've managed this pandemic at our best of our ability, and I can argue in our community with our team, meaning the whole community, we've done a better job, if not the best job, out of many communities in the state. So I think at this point, those are the types of examples that are specific to our community. When you look at transmission rates in community, and lots of guidances at all levels for everything, they say, look at transmission rates in community, and that should help guide your decisions. Well, we live this and breathe it every day. So we take that data, and that helps us make decisions. This is just a bureaucratic step in a process that we don't know. It's not necessary at this point.
Are there other examples of rules that you would like to change?
Yeah, I think anything with local authority related to public health at this point needs to be in our realm. Obviously, there's different things that are statewide, like mask mandates and things that I think you need to have the same rules across it. I think the vaccination program needs to still be centralized with them giving more to us. But these other rules on industry that really the risk is based off of local transmission rates, that is a local decision based off the local experts. And I think that's just kind of where this needs to go now. And that's not saying the state hasn't done, I'm not criticizing the state. I'm just saying when we're different from when our positive rate's under 1 for over a month and another part of the state's over 4 or 5, our rules should be different than that. I know if my positive rate was at 5, I would be managing the crisis differently than I am when it's under 1.
Would you increase capacity at restaurants?
I think 75 is a good number right now. I think the hours of operation is problematic.
What time would you have them closed?
Well, I think you could extend it to 1 o'clock. I think that's a rule at this point that people know the rules, and I think that's kind of a silly rule at this point.
I want to talk about jurisdiction a little bit because the state's only mechanism for enforcing this is the liquor authority. Is that your understanding as well?
Yeah, it's an important. Yeah, that's a big deal though. If you're a restaurant owner, that liquor license is your lifeline. So,
right. But the only mechanism the state has the only authority they have is through the liquor authority,
which is the end all be all, or they can fine you for these other gatherings, right? So. They're and again, we have teams that go out and monitor this to make sure people are doing the right thing. This isn't a free-for-all, but people are doing the right thing. And if you're not, we'll fine you, just like we have. But again, these decisions should be made based off of local transmission rates at the local level. So if the state still wants to control this process, we need to be very nimble. There needs to be an easy approach to make these decisions. You can't make these decisions at the statewide level at this point if you have one community well under 1% for a month and you have other communities that just aren't there. So I understand that you don't want to potentially change state policy based off that, but give us the local control back then.
What's the county's jurisdiction to monitor something like a restaurant? Just health commissioner?
Yeah,
powers
we have
to
a pretty
shut things
important
down?
role in that too, with the health permits. So we both have really, in obviously with these social distancing rules and whatnot, the governor's made it very clear that local governments need to enforce, right? So if we're enforcing it, we should probably be making the rules too.
You spoke to the state today, you said, and you've been mentioning that you want vaccine eligibility to expand quicker, 50 plus, you mentioned today. Did you feel optimistic about that happening after your conversation
Yeah,
with the state
we'll see.
today, or you think it will still be slow?
I think we know how these. So I think each week they've been loosening it up a little bit. I think the governor usually makes those announcements, right? So I'm sure, hopefully he'll make an announcement this week.
You talked about purchasing the barriers. I spoke with the Central Square School District on Friday, which has one building in Onondaga County. The superintendent there is not doing as many barriers. He wants to do face shields, which he thinks is a fair substitute. Dr. Thomas at Upstate thinks it's a fair substitute. Wondering if the county would fight on their behalf to get the state to recognize it as a fair substitute, and if you'd purchase them as a county for other school districts.
Yeah, so we looked at this. The state says it's not okay. So we looked at this, or else we wouldn't have done partitions. And so if that changes, we'll adapt. I think Dr. Gupta was comfortable with it, but we talked to the state specifically about that.
But the phone calls that you're on, you've been fighting for some different changes to policy. Is that one you fight for?
Look, we're comfortable with the partitions. We understand people are more comfortable with this or that and different things, but we asked about face shields to the state. Is this allowable as a something equivalent to the partitions? The state of New York told us no, it is not. So they were clear on that. So if they told us it was, we would have said to everybody in our guidance in our county, and that one building is in our county, so it falls under our rules, is that it's not either or now. It is a partition or 6 feet. So, we thought the face shields would have been a good solution. We got confirmation that it's not allowed. So that is what it is.
But again, is that maybe an example of where the state is
Correct. If that
using-
was to your point, that's an example where why isn't that our call, right? Just so everybody understands the process. If there is a positive case and there is a policy that then drives positive cases, it's in our interest not to want that to happen, because we're the ones who then have to do the work. We have to do the contact tracing. We have to work on this. We want to end this pandemic. It's not in our interest to put forward any policy that we believe adds more risk to this pandemic. The reality is we've done a very nice job managing this as a community effort, and that's where we are. So we need to rebalance where things stand. I think there's about in total between 200 and 300. Is that right, Ann? Yeah. Maybe 20%, 25%.
So what safety protocols do you have in place to kind of keep them safe and then set the standard for other private businesses and contractors?
Yeah. So first off, these employees can all be vaccinated, right? So we've encouraged that. Second off, we are doing, the employees are getting tested before they come back. We're offering testing during the week. We've made numerous capital purchases to MERV 14 air filtration systems. We have the Healthway system, air filtration systems on each floor, and certainly the physical distancing, mask wearing, is something that you have to do as well. So we do temperature checks when you come in. This is as regulated of a facility as you can get. So at some point, you're at a different stage in the pandemic, and we have to move forward. And that's kind of where we are. During the summer, we moved forward too and brought back more people. And right now, it merits coming back forward. We have to prepare to serve this community in the next phase when we're done with vaccinations, when we're helping lead the recovery for our region.
On the homebound vaccine phone bank, which is new, we've been hearing from some people today that they've been calling and just having it ring, and members of our team did try it too. Are you aware of any issues or anything that, you know, we can tell people about that, why they might have gotten that ringing, or is it just so busy that that could have happened?
Yeah, well, usually when you do this, you just staff up based off of the activity you've seen. You know, you're guessing, right? So you look at it, and so today we'll get a report on you know, kind of a capture rate. How busy was it over there? How many more people do they think they need to answer the phone? And then we'll adjust. We'll put more people there. So again, we don't know how many homebound seniors there are right now that still need to be vaccinated. So this is just, you know, a tool we have, and we'll have to adapt. If we need more people to answer calls, we will. And I'm sure we'll probably add on in the next few days, and then we'll probably have to take off when the phones stop ringing.
Is the county screening people who come from outside of the county, like to the expo center, or, you know, to get vaccinations from out of the county? Are there any issues there with that?
Yeah, so we do. So at the On Center, it's really a county location. So we do obviously get everybody's information. Certainly, if you work in our county and you're in a neighboring county, there's a level of you know, teamwork that goes on. We've had county residents go get vaccinated in Cayuga County and Madison County. I know that for a fact. The Expo Center is it's a statewide site, so anybody from throughout the state can go there. Most of the people that do go there are county residents, but you know, that's how it works. So at our site, about 6 or 7% of the people are from outside Onondaga County, but are Central New Yorkers.
You mentioned how public employees can get vaccinated.
Mm-hmm.
That includes you.
Yep.
Do you have a plan?
So I got vaccinated late Friday afternoon, and with the Pfizer vaccine, and again, it was fine. I'm a little bit of a baby with needles, and I got my shot. It was
It's
good.
a very low-key shot. I'm surprised.
Yeah, you know what, Andrew? I've with with some of my health issues right now, I wasn't gonna put myself in the public spotlight with that to see how I responded. So, Friday afternoon there was some leftover Pfizer, and I got a phone call, and I said in the beginning of this process I could have gotten vaccinated a long time ago. That I was going to, when I felt comfortable that the seniors and those who have multiple comorbidities had equal opportunity at the vaccine supply, I would then allow myself to get vaccinated.
Speaking of, sorry.
That's where, and that's where we are, right? So we're now getting out to the hardest to reach members of the population in those brackets.
Before you change the subject real quick, how did you feel?
I'm good. You know, I got a shot, a little sore the next day, but I'm here on Monday, right?
On leftover doses, though, I just want to go back and reiterate my question about any wasting of vaccines.
Nope.
What are some of the efforts the county goes through to make sure that no dose is wasted? Obviously, you said you got a call, and that's how you got vaccinated.
Yeah, so you can control, what you do is you manage the end of the day, right? So you look at your no-show rates throughout the day, and throughout the day they're adding in more, opening up vaccine and adding in more shots. So you manage that throughout the day. Again, we will never waste a shot at our pod. If we found a 25-year-old healthy person walking down the street and we had an extra shot, they're getting it. That is what it is. I'm not going to bend on that. We won't waste one. And so at the end of the day, we knew there's always a couple no-shows. We knew there would be an extra shot, so I said, okay, I'll go get one.
You already brought up tomorrow, which is the one-year anniversary of the first case of coronavirus confirmed in Onondaga County. What does this past year mean to you?
It's been a long year, and when you relive it all, and you still a lot of work to do. It's just a mixture of emotions, right? And there's a lot of highs and lows in each day when you're in behind the scenes in these roles. But there's more highs than lows. If you look at what we've accomplished, the challenge put in front of all of us from a personal standpoint, and then a government standpoint, and then a community standpoint. So, you take some time to reflect, and we're talking about it, right, in different interviews, and we'll have to relive it all through a lot of your reporting that you'll all do. But I think the community should be proud of what it's accomplished, and there's been a great level of teamwork in this community, and I think we can build off of that as we move forward into this next phase. So it's been an emotional year for everybody, myself included. It's been a long year. I'm happy we're getting through this next step of the process with vaccinations, and then in short order we'll be focusing in on recovery, and we'll have more challenges, but we're getting through all this.
Is there any new data or any new kind of significant tracking of the different variants that we've seen? We've seen a few cases, a handful in New York State, but the UK variant, the South African variant, anything that the county and the county health department are tracking?
Yeah, so what happens is when there's variants, the Wadsworth lab does sampling on positive cases throughout, and they get samples from all the counties. And we haven't been alerted to any new trend out of our samples. We had cases of the UK variant. Once you have a case of the UK variant, they watch in those areas very closely. They look at the quarantine contacts very closely to see if they turn into new cases. That happened well over 30 days ago. We haven't seen any more of that. There's a question on a New York City variant, right? A question on a Los Angeles variant. So I think the good news with all this is that the vaccines that have been approved seem to be very effective against the various variants, and that's really positive. And I think that's kind of why you see us stabilizing. I think our data won't get better until we can vaccinate that 18 to 40 crowd. And then once you vaccinate those demographics, I think our data will get a lot better because that's kind of where we're seeing the cases. Other questions? Thanks, everybody.